Hello, thank you very much. It's indeed an honor to be here. I want to thank everybody, the panelists, our guests, partners, angel investors, future sponsors, and our wonderful users. Welcome to Zuri 2.0. Our idea of building a comprehensive mobile solution for people seeks to try and do a few things. One, seeks to try and address some of the challenges we have in the healthcare sector. One of the things we always say is that the biggest economy in the world finds it very difficult to provide affordable healthcare for its people. And Zuri Health attempts to fix some of the challenges we have in terms of cost, logistics, and distribution. And as we evolve we built out an app that has a pharmacy feature, aggregates pharmacies. People are able to book medications, over-the-counter and prescription medications on their app and have it delivered to them at home. Convenience, ability to do tests. One of the things COVID taught us was that a lot of the tests and diagnostics we go to the hospital for, you can even do that at home. So with our partnerships, we've been able to deliver over 2,000 tests, COVID tests precisely, in Kenya. And our app also has a telemed feature. The telemed feature allows people to get remote consultation with doctors and specialists based on location. And we have a medical concierge service, Doctor at Home, where people are able to book for medical professionals to come talk to them, see either aged parents or younger kids. Now, one of the key things we have is that Zuri Health tends to try and tackle a very important problem in healthcare, distribution. When you look at the doctor-patient ratio in Africa, you see it's very appalling. In Kenya, it's like four doctors to about 200,000 people. And it makes it very, very important that we figure out how to use technology to disrupt the distribution problems for doctors. And what we've looked at is a lot of healthcare solutions have been built for people with smartphones. Yes, they're very important. But 65% of people with smartphones, 65% of mobile phone users do not have smartphones. And they are most likely to be in the underserved communities and most affected by issues of pricing. What we're doing at Zuri Health is to be able to take care as well as the smartphone users, as well as 65% of those who do not have access to smartphones. And we've put an SMS feature that allows for people to be able to get first-level medical consultations on text. It's important for us to understand that while you might have a doctor surplus in Nairobi, where in Kenya, places like Marsabit, Isiolo, Waji will have issues of finding doctors due to problems of insecurity, be it lack of infrastructure, or maybe because people don't want to move to those areas. But those people in these areas demand access to healthcare. And for us at Zuri Health to believe healthcare is a human rights issue, and our approach is to be able to tackle the issue of distribution across the continent, in multiple countries, and that is what we intend to do at Zuri Health. So thank you very much for joining us today as we try to do this. It's important to also share our traction. We launched in January this year, and in 6 months, we were able to have over 2,000 doctor interactions on SMS, over 2,000 tests booked on our labs and diagnostics flow. We've had 6 to 8 partnerships with mobile telco companies across the continent. We're seeing ourselves in Dakar, Senegal, Accra, Ghana, Nigeria, Lagos, Nigeria, Maputo. We're in those locations and ready to roll out what could possibly be the biggest tech product for mass market healthcare. This is our vision at Zuri Health, to ensure that anybody who has access to a mobile phone, smart or not smart, has an opportunity to be able to engage a doctor and get first-level medical consultation. We want to change healthcare, and that's our goal. And it's important to also point out that we will want to work with everybody, partners, and that's why I'm happy for the panels we have today in terms of the partners we've been able to secure. Everybody is a partner. We want to work with the government, we want to work with regulatory agencies to fashion out a health tech solution that seeks to address challenges around preventable healthcare, which is a big challenge for us in Africa. We're building a product for Africa. That is our plan and that's our goal. And we'd like to hear from a couple of our users, a couple of our partners, so some testimonials, then we can continue the program. Thank you again, and you'll be seeing me shortly. So let's hear from some of our users and testimonial videos.
My name is Kaga Mungai and I am a creative entrepreneur and musician from Nairobi, Kenya. The reason I use Zuri Health is because in my line of work I travel quite a lot, and these days with the way the world is, it's important to have your tests done frequently, but also it ensures your safety. So all I have to do is I log on to the Zuri Health app and I am able to get people to come directly to my own home. They take the tests and within 12 to 24 hours I have my results. And so it's really easy, it's really convenient, and that's the reason why I use Zuri Health.
My name is Eldrick Frelish Mtamba. I'm a businesswoman. Zuri Health benefit so far because nilikuwa na complication za mimba niko nayo miezi 2. Nilipokumbuka niko na Zuri app kwa simu, nilikimbilia kwa simu, nikapatia na order za dawa zangu, wakanifanyia delivery. So sasa I feel good. So I prefer Zuri any day, anytime, always.
I'm Dr. Olwang Yvonne, a pediatric surgery resident at the University of Nairobi. Working for Zuri has been a great experience for me. I enjoy and I love changing people's lives, and it has made that easier. I can do it at the comfort of my home or wherever. I just access the app and manage my bookings according to my schedule, and this makes it convenient and flexible for me. Also, with my daily interactions on the app, I'm able to get great exposure, which will help me build my brand in future. Lastly, the additional income is a plus for me.
My name is Dr. Kelvin Odongo, a pharmacist by profession, currently practicing at Checkups Medical Center. At Checkups Medical Center, we endeavor to offer medical services conveniently and at very cost-effective rates in the Kenyan market. We are currently located at Upper Hill in Nairobi, at Jomo Kenyatta International Airport Trade Center, and are putting up another clinic to get better reach around the industrial area at Lusaka Road. We are a rapid outpatient clinic facility that offers options for patients to walk in, see our doctors and specialists on schedule, or for us to go to them, that is in the name of mobile services. So the mobile services range from COVID testing to routine lab works, where we send our lab technicians to come collect samples from you. We also do teleconsultation services to support this and do medication delivery either to the home or to the offices. Our partnership with Zuri came at a very convenient time when we were on the verge of scaling to reach more people. And what Zuri has done for us as Checkups Medical Center is put us out there in the market and given us better visibility. So how we partner with Zuri is that they send clients to us and we're able to afford these mobile services where we send people to do COVID samples, collect samples at their homes, and deliver medicine as well to them. The feedback we've gotten from Zuri so far is that the pricing is quite fair and they found it very competitive. And for the clients as well, having partnered with Zuri, the convenience that comes with having to just call and you get your order sorted has been very fruitful.
Kwa majina naitwa Michael, mimi ni taxi driver. Nashukuru kwa hii app ambapo naweza itumia kama kwa SMS. Kila mara mimi hupata ujumbe mfupi ambao unaniarifu kuhusu mwili wangu kiafya. Sio lazima uwe na smartphone. Kuna ule ujumbe mfupi unaoweza kutuma hata ukiwa na simu kama hii ya kwangu. Unaweza tuma SMS na bado unaweza ongelesha daktari kuhusu ujumbe mfupi na daktari anakujibu. Mtoto wangu juzi alikuwa mgonjwa, lakini kutumia ule ujumbe mfupi, nashukuru niliweza communicate na daktari, akaweza kunipa maelekezo kwenda kununua madawa ambayo kidogo ilinisaidia before niende kuona daktari.
My name is Keyuru Jobanputra. I'm a director at Travel and Style Limited. We are a 34-year-old travel company, travel agency and tour operator that has been operating in Kenya. We have travel arrangements for all our clients all over the world, not just for ticketing, but safaris, holidays, beach holidays, and everything, pretty much wherever there's an airport in the world. Our partnership with Zuri and Travel and Style is very beneficial to all our clients, especially at the end of the day, we have to see convenience and give our clients a value for their money. So it's a very convenient service whereby we can give this service as a convenience to all our clients, whereby when they're traveling out of Kenya, they're required to have a negative COVID test. And our partners at Zuri actually go to the client's residence and collect the samples. And the clients don't have to leave their homes and actually go to a lab to submit samples for the COVID test. And this works very well with the clients who are actually coming into Kenya as well, the tourists, because when they travel back to their countries, they obviously have to have a negative COVID test at that time as well. And the convenience here is that the clients don't have to be taken to a lab physically to submit the samples, but our partners from Zuri go there, get the samples, and within 12 to 24 hours, they're able to get their email results on email. So it's very convenient, and we're hoping to grow this partnership more and more in the future.
Wow, that sounds so great. I've actually used the app before. I needed to get some samples to a doctor, and with everything going on, I didn't really want to leave the house and go to a clinic and do all that. They actually came to my house, collected the samples, and I had the results within 4 hours. Can you believe it? It just made everything so convenient for me, and this is definitely an app that I'm going to continue using. So we're going to move right into a panel discussion now. We're talking about the role of telemedicine in a pandemic and what the Zuri Health advantage is. So I'm going to do the introduction of our panel. From the far end, we have Ike Anoke, who is the CEO of Zuri Health. We have Daisy Isiaho, who is a co-founder of the app. We have Dr. Hoffman Moka, who is the CEO at Checkup Medical Hub, who is one of the partners with Zuri Health. We have Dr. Yvonne Olwang, who you also saw give a testimonial, you're our friend. She's one of the doctors on the app, and we're just so happy to have her here. And we have Dr. Moraka Ngoi, who is a pharmacist at Leleshwa Pharmacy. I'm like, Leleshwa Pharmacy, Leleshwa Wines? We talk later? No? Yes? Okay, so we'll talk later. All right then, so without much further ado, let's get started on this discussion. I'm gonna pose the first issue to Daisy. So Daisy, building a health tech platform in a pandemic must have been really interesting. Would you tell us a little bit about your experience?
Wow, it has actually been a very interesting journey building this product during a pandemic because it was very effective. It came at a time where we needed to practice social distancing, and what a better way to practice this by enabling teleconsultation and telemedication, because we're reducing the risks of the patient physically visiting the hospital and also the life of the doctor, because we noticed a few of the issues where hospitals were congested and you find that people were finding it very hard to actually visit the hospital, make bookings and appointments. And the fact that now globally, there are a lot of frameworks around telemedicine and the importance of telemedicine, we find that we had an arm and a leg at this time where the importance of telemedicine, especially in Africa and the entire global world, was very important because it's now easy, it's very seamless. Most of the consultations, I can attest that when patients visited the hospital, someone would tell you it was not really important for me to physically go to the hospital and have those expensive and inconvenient hospital trips. But now it's easy to actually consult with a doctor via audio-visual consultation, get your treatment right, buy your medication, and just the convenience of the whole round experience. And I think that was a very beautiful journey. Of course, there were a lot of challenges building it out because sometimes we had to work from home. Our developers had to suffer from power outbreaks, communication barrier, but you have to do whatever it takes because it's something that is very important at the moment. And we see that through telemedicine and building Zuri Health app, we've been able to save a lot of lives.
Wow, that sounds like it was a wonderful experience. Again, remember we said that if you have a question to ask at the end of the panel about anything, please put it in the chat so that we can come to it at the end of the conversation. Okay, I'd like to ask Dr. Wang, so how effective is text messaging as a means of consultation?
Okay, well, because of how accessible text messaging and technology has become, for the patient, number one, it has improved access to healthcare in that the patients who are geographically isolated, they can easily subscribe, send a message and get instant consultation. Then number two, for those patients who for apparent reason they don't have internet, you can easily send a text message and then get instant consultation. Then number three, also we're in the era of COVID, so with the preventive and the restrictive measures. It controls that positively by limiting the spread. Also, it's affordable for the patient. The transport cost is reduced, and also the cost of consultation is also reduced. And then you don't have to miss work also. You can just subscribe, send a message from the comfort of your office, or if you're at home, working from home, and get a consultation. And then for the doctors, it's flexible and convenient. You can do it from the comfort of your home or wherever you are. You just access the app and then manage your bookings. Also, it decreases the rush you get with queues at the emergency department. So you're able to plan and give full attention to your patients. Also gives you an additional income. And in the era of COVID, it reduces your chances of exposure as well. Yeah.
Wow. Okay. Could you just share with us, take us through a user's journey?
Okay. So for myself, I access the app through my phone, the Zuri Health app through my phone. And then for the patient now, after they've subscribed and send a message via text, I get a prompt. So when I get the prompt via email. So when I get the prompt, I reply within 3 to 5 minutes. And the questions are usually just general questions from their reproductive health, or somebody with hypertension and diabetes. They want to know how to manage their medications or lifestyle modifications, or how to do their regular medical checkups. Also, maybe somebody just woke up and has a runny nose or a headache, and they just want to see how to go about their day. Easily send a text message, and we are ready to respond.
Wow. It just seems wonderful. Well, okay, so Dr. Moka, prior to the pandemic, about 97% of lab tests were done at the hospitals. So how has the pandemic and growth of telemedicine changed your business approach?
That's a heavy question. Thank you very much, and delighted to be here. Congratulations to the Zuri team. Before I answer your question specifically, I'd like to preface my thoughts by saying that launching an application in healthcare is one of the most difficult things you can ever do in your life. I was listening to the interviews by Jeff Bezos after he came back from space. He described, preparing to go to space as more difficult than launching Amazon. And I'm willing to say launching a health app is more difficult than going to space. And the reason is that one would look at the healthcare journey as a linear journey in terms of, okay, you get a doctor, you get labs, you get pharmacy, and then you get your results and you're good to go, you make a payment. But we fail to appreciate the diversity and the variety of ways in which people access healthcare, right? And so it usually starts with a question which could be rather benign, or you could start with a question that is very well defined. Now, before the pandemic, we had been conditioned as a human species, especially in the market, that you must go physically to a location, wait for hours on end to talk to somebody for 3 minutes, and we have known that is okay, right? So I'd like to really underscore the word we have been conditioned, right? Because the challenge with healthcare is to decondition the mind of the consumer to now say it is okay to call. It is okay to call. And that is the Achilles heel of the whole conversation here. So now really what the pandemic did in a very fundamental way, it became more permissive to call, right? Because many people said, well, the doctors are too busy. Dr. Ola is too busy, don't call her, just go wait in her office, she would see when she's ready. Now people say you call, you understand? So I would say that is a fundamental shift that we have seen, and we hope the trend stays that way. Now, specific to labs and diagnostics, it has shifted the market from what we would describe in medical parlance as provider-initiated requests to consumer-initiated requests. A provider-initiated request is you'd have a lab script written by the doctor, and the lab test you don't understand. FSBS, HBH, HbA1c, CBC. So you're looking at it and you don't even know what you're going to get in the lab. They say, give me your blood, you give your blood, and you hopefully everything is okay, right? With COVID, right, as an index disorder, everybody knows I want a COVID test. So you can now start looking for that opportunity. And we are seeing now consumers now start searching online to ask very specific questions. I want a test for this disorder. I want an ECG, which is something we're not seeing before. You understand? So I'm very excited and really proud of the work that the Zuri team has done, because, when I met Arthur a while back, I listened to what he was saying and his vision. It's a very important thing to do the right thing. And they are doing the right thing. And secondly, is that the timing is right. And the only other thing that needs to happen is having the team to take it to space, right? And so, I'm really proud of the work they have done. And in his opening remarks, he mentioned we are building a comprehensive system. Now, when you hear that, I would say, borderline, it is madness. Because building a comprehensive healthcare system is not easy. Thinking about building a hospital in the cloud, that's what you're doing. You're building departments, you're building workflow, payment systems, having doctors, and you're creating that in an abstract environment. That is fundamentally how difficult that is. And I would say you're doing it on the heels of like, well, I want to see traction, but you're not seeing walls go up. You understand? So it's extremely difficult work. And so really want to commend them, because what we are seeing, our counterparts in the West, they are building unimodal systems, telemedicine solutions that are only for scheduling or for imaging, artificial intelligence imaging, for radiology. So we, on this other side, innovating, are doing it in a really crazy way, trying to kind of create a health experience in one shop. So I want to really underscore that it is amazing, it's an amazing vision, and it's not easy. And ours is to provide full support to this vision as partners.
Okay, so do you see telemedicine as a necessity for diagnostics in healthcare today?
I would say it's more than a necessity. It's moved past the point of necessity. It is now a matter of equity. You understand? Because those who cannot access a doctor remotely would be left behind. You understand? It's now a differentiator in terms of, can you run the race of healthcare or not, right? Because when you're online, you have a couple of things. You can choose the doctor that you want to see. You go online, you choose who you want to see. You choose the price of the medicines you want. You can pick and choose. That already is a differentiator. Compared to when you go in physical, you have to deal with whoever is in that room. You have no choice. So it's a matter of equity at this point. And so one of the things that we have to do in an ecosystem is really ensure that, we support an ecosystem that makes technologies like this thrive. That is a difficult challenge. Yeah.
Okay. Yes, and they're up for the challenge, yes? Don't laugh, say yes. Laughing in joy and yes. Okay, all right. So, Dr. Mora, let me ask you, what advantages do telemedicine platforms provide to smaller pharmacies to make them more competitive in the market dominated by well-funded pharmacy chains?
Well, yes, what we have been seeing recently is the advent of pharmacy chains all over. If you just look at Nairobi alone, you'll be seeing the same brands in almost every corner. So for independent pharmacies like myself, what it does is give us visibility. It gives us access to customers who ordinarily would not come to our corner or our territory, the territory that we normally provide to. And the app this advent of like the Zuri Health app has come at a good time because the customer journey, if you look at it at the moment, it has reached a point where people are calling in anyway. They're calling in, they want their medicines delivered, they want to have consultations over the phone. And so by having the app, it kind of pulls more people together. It makes the circle tighter, and even in terms of access to the doctors. It's easier for me to call a doctor who will be on the app to say, hey, maybe shall we look at this interaction? It makes the customer journey shorter because I have quicker access to the doctor as opposed to maybe calling a doctor's surgery and we're waiting, we'll maybe find the secretary. Sometimes it's a hit and miss. So I think it makes our ability to serve the customer better and more efficient.
And also makes you more visible generally.
Oh, it does, yeah. That really does help in terms of business.
Yeah, I've seen a lot of people talking about how this whole experience of you go to the doctor and you have a 9 o'clock appointment, and then you expect to be seen at 9 o'clock, and then you get there and you're like, no, everybody has a 9 o'clock appointment.
Yeah.
Wait till the time you're called, you know, and you're like.
And then imagine trying as a pharmacist trying to get access to the doctor to query a prescription that they've already done. So you see, it can take ages before the customer is actually fully served, before that circle is complete.
Yeah. So as a sick person, then instead of just standing up and going to see the doctor and coming back quickly, it takes so much time that this makes it easier. You just go onto the app, look, be like, these are my symptoms. What can I get? Order the medication, have it come to your house, so you can rest and recuperate while that's happening.
Yeah.
Okay, so I'm gonna ask this to IK. We have a lot of telemedicine companies in Africa. Most of them have to include physical location in order to get customer trust. What is the Zuri Health advantage?
Yes, thank you very much. That's a very important question. I think that, this whole thing is about the Zuri Health advantage. Like what Dr. Marcus said, first thing we're doing is we're trying to build a virtual hospital. We know the challenges of, so think of, having an app. You have one app for doctor consultation, one app for pharmacy, one app for labs and diagnostic center, one app for remote care. It's hard. Phones, what's the space on your phone, in terms of being able to accommodate all these apps? And thinking of navigating from, I spoke to a doctor and I got an online, prescription, and I have to leave that app and go to another app, try and buy medication from a pharmacy. It's very difficult. And what we're trying to provide is convenience. So Zuri Health advantage is the ability to bring the ecosystem in one. It's a health super app that makes your journey start and end in the app. So think of a person waking up in the morning and you're not feeling well, you engage a doctor. The doctor requires you to do some tests and sends you a list of tests. You go on the app, same app, book a test, and have them come and collect the samples at home in most cases. And they're able to send you your result on the app, and you'll be able to share that with a doctor who decides to say if you're going to come back to the hospital or based on your results, you need to buy this medication. And then the same app gives you an e-prescription. In that e-prescription, you take the e-prescription and you go to the pharmacy session and you're able to buy your medication and it's delivered to you from home. And in the Zuri Health 2.0 app, one of the important things to point out is if a doctor gives you a prescription, we have a security feature that keeps the doctor's name, and number on the prescription and validates it on the back end, including the duration, so that you do not have to reuse that prescription again. So that is validated on the app. Now, it makes it easier. It reduces the time that you have to go to the hospital. That's time to access healthcare from 48 hours to barely 12 hours. That is the real advantage. Remember also that we're saying that about 45% of those who go to the hospital do not need to be at the hospital at that same time, because removing them from the hospital creates opportunity for people who are in critical health need to be able to access a doctor. That is the real advantage. But also, let's look at those who do not have smartphones. 65% of mobile phone users do not have access to smartphones. These people are the people who are the most vulnerable, do not have insurance, live in areas where the doctor-patient ratio is even more appalling than you see in the urban areas. Do they not need healthcare? They need healthcare. So we are trying to also provide for the marginalized community. So think of somebody in shags in the village, right? So let me think of somebody in outskirts of Borno State in Nigeria, having issues with conflict, insecurity, and the person is feeling somehow. The person needs to be able to get access to a doctor who is based in Lagos on text message. Because remember, a lot of the challenges we face are preventable healthcare things. So think of our SMS service as a WebMD on text. So if you, as a smartphone user, feel some type of way, you go on your phone and you search, right? Now, think of somebody who doesn't have a smartphone, ability to get that information from a doctor in their location. And also think of the other opportunities, including people who have, issues that they don't want to discuss, anonymity, they want to talk about some, especially when it comes to reproductive health challenges, you want to, mental health challenges, you want to engage. Those are the opportunities being created, and this is the Zuri Health advantage. Also, what is the Zuri Health advantage? We are also not focused. Africa is our market. And we say that, sometimes investors, you don't want to, Africa is our market. We want to take Africa on. That's our vision. From city to city, from Lagos to Lusaka, from Nairobi to Accra, from Maputo to Dakar, we want to be able to affect people and try and be a partner in fixing the healthcare challenges we have. So this Zuri Health advantage is from being able to bring the health ecosystem into one. 2, being able to provide an opportunity for those who are the marginalized and underserved community. And most importantly, cost. It will cost you 5 Kenya shillings every day to get first level medical consultation from a doctor. The cost of a matatu or a bike, a Buddha or Okada, whatever they call it, to the nearest health center is more than 5 Kenya shillings. But for 5 Kenya shillings, you're able to talk to Dr. Moka or Dr. Olang to get first level medical consultation. Fixing the challenge of cost. So think of a huge percentage of the community or the huge percentage of the population without insurance. They don't have insurance. And so think of a man at home with 4 kids, ability to get first level medical consultation on preventable health issues, being at 5 shillings and a day, and can ask as many questions as possible to the doctor, and before you get to the health center. So this for us is the Zuri Health advantage. Cost, convenience, and most importantly, spread.
Wow, okay, I'm sold. If I didn't have the app, I would download it now. Speaking of that, we will be telling you about how you can download the Zuri Health 2.0 app. And like I said, I'm just going to remind you, if you have a question, such wonderful points and such wonderful things have been brought up in this panel discussion. So if there's something that you'd like us to answer, please type it in the chat so that we can ask it, so we can come back to you at the end of the whole program. Also remember that you can speak to us online on social media, use the hashtag Zuri 2.0, and we'll come through your tweets or your Facebook messages or your Instagram posts and come back to you on exactly what it is that you're talking about. But without further ado now, I would like to ask our CEO to come up and speak to us about Zuri 2.0, what's new, where are we going?
Thank you very much. Again, I want to thank our viewers, thank our angel investors, thank future investors and our panelists. And I know I've been invited to come and introduce Zuri 2.0, but I think it's proper and fitting to invite my co-founder and our chief product officer, Daisy Chiago, to come and take us through the journey she and her team has built. Daisy is responsible for product promise, product evolution, and she's been responsible for driving Zuri 2.0. So it's an honor to invite Daisy to come and join. Thank you.
so much, viewers, who are all tuning in to view our dream come true today, the fact that we are launching Zuri 2.0. It has been a beautiful journey, and I feel like, you know, I'm just honored, we are privileged to have this day today with us. Initially, we launched the first product, Zuri 1.0, and through Zuri 1.0, we gave our patients the ability to be able to chat and consult with a doctor via the app, buy medication from pharmacies, book labs and diagnostic tests, and have their doctors visit them at home if they need be. And now the best part about Zuri 2.0, we've introduced a beautiful product that will be able to tap into and scale across different markets, because with Zuri 2.0, we have introduced multiple language options where people from other countries in Africa, if you're in a French-speaking country, a Swahili-speaking country, you're able to engage with a doctor. You can select your language. If it's English, if you want to speak in Swahili, in French, you're able to go through this. And we also made it more user-friendly, a better user experience for our users, seamless and easy to use for any user who has never interacted with an app platform. Now with Zuri 2.0, we have two different apps. We have independent patient app and doctor's app. Now the doctors can seamlessly have their app version on the app, and also the patients can have the Zuri Health app version as well. And we've also introduced with Zuri 2.0 the Safiri na Zuri, where you can book COVID-19 tests seamlessly through the app. If you're traveling, you don't need to go through the stress of finding out who will I book my COVID test with, where will I get my products, how will I get it done. Time constraints, very easy, seamless, user-friendly, and efficient. We've also introduced with Zuri 2.0 the availability of AI, artificial intelligence chatbot, where you can now engage with doctors through our social media platforms. You can buy medication via WhatsApp, social media platforms across the app, and you get prompt response. So, introducing to you Safiri na Zuri. Safiri is a Swahili word that means travel with Zuri. With the outbreak of COVID-19, we've seen a lot of major challenges in the global economy, where we've had travel and tourism being the most affected. We see that a lot of countries have closed their borders, introduced strict measures in terms for travelers. The fact that now you must travel with a COVID-19 certificate in order to travel across the borders, and mandatory 14-day quarantine in some of the destinations that you need to go to. And we see that currently, in terms of the COVID-19 requirements, we see that now you're required to present a negative COVID-19 test, which is done 48 to 96 hours prior to your departure. You need to have a COVID trusted travel code, that's a TT code, and you also need to mandatory quarantine for passengers that are arriving from certain cities. And what opportunity do we have currently? We see that most countries that had closed their borders are beginning to open up their borders for travelers. And we did a survey, and we found out that now travelers find it now easy and are more willing to start traveling again, be it for their business, for their leisure, because the markets have opened up. And now we find out, first of all, travelers want to travel, but they are facing a lot of challenges traveling during these times. And what are their challenges at the moment? So far, we see that the high cost of COVID-19 tests. Currently, you have no idea where to do your COVID-19 test. I'm traveling to South Africa from Kenya. I know I've done my COVID-19 test from Nairobi, Kenya. When I'm leaving South Africa back to my country, where do I get the test done? So we are trying to solve these kind of challenges and problems. Also, the access and time. It takes too much time and effort to just search and filter and find out who is an approved government COVID-19 test center. We also see there's limited information online. A lot of travelers are having a challenge finding out you're on your trip, holiday, relaxing, but you're thinking about, when will I do my COVID-19 test? Will it meet the time? I only have 48 hours. I'm traveling tomorrow. Will I get my results on time? Will I be able to travel? And now here, this is why we tell you Safiri na Zuri, travel with Zuri. First of all, with Safiri na Zuri, this is what we do. We provide accessible and affordable COVID-19 tests to travelers via a mobile app. Currently, it's very easy to book your COVID-19 test from the Zuri Health app. And you ask yourselves, how do we do it? So we do it through partnerships. We partner with a lot of approved COVID-19 test centers and travel agencies to provide these tests and services to travelers easily and quickly at the tap of their hands. And we see that what our travelers get, first of all, they get convenience. The fact that someone is able to come and do and take your COVID-19 test sample, whether you're at work, at your hotel, or at the office, conveniently. We provide affordability. Our COVID-19 tests are very, very affordable. This is through the partnerships and the packages and the seamless processes. And variety as well. When a user or a traveler books a COVID-19 test or Safiri's Zuri, they are able to get variety of options. I'm not only able to book for my COVID-19 test, I'm able to access other healthcare services, be it the pharmacy model, consultation with doctors. I'm traveling, I have a headache. What do? Chat with a doctor and you get that prompt. You don't need to start hustling where to go to a hospital at your destination. And the more advantage why you should travel with Zuri, why you should Safiri Zuri, is the fact that when you book with us, we give you a 30-day free consultation from wherever you are, and we also facilitate COVID-19 tests at your destination. If I'm traveling to Nigeria from Nairobi, Kenya, I am able to facilitate your Nigerian COVID-19 test, and as you Safiri Zuri, you guarantee that you'll be convenient, safe, and you'll have a trusted COVID-19 test partners. And so the COVID-19 test process is very smooth and seamless. First of all, you just simply need to download your Zuri Health app, which is available on the Google Play Store and App Store. Book your COVID-19 test from the lab section, where a specialist is dispatched to where you are, picks up your sample, and you get your results in 6 to 12 hours prior to departure. These results, you get them conveniently as well through your email and phone access. So from today, you do not need to worry about your COVID-19 test. You're a traveler, Safiri Zuri.
Thank you very much. One of the things about Safiri Zuri is our ability in certain routes to be able to provide convenience for you. So if you're traveling to Cape Town, if you're traveling to Johannesburg, Accra in Ghana, Lusaka in Zambia, if you're traveling to Dar es Salaam, we have partners who are able to come and take your samples at home and ensure that you have a seamless experience traveling. So it's important to mention, in our conversations or discussions with, as we're building our Safiri Zuri, what do you need to travel? What are the challenges? Our customers talk about issues of travel insurance, talk about issues of, if I'm going to go to Lagos, how do I know where I'm supposed to get my COVID test, the convenience? And we figured that our competitive advantage, one of the important things we're supposed to do was to bundle such a service. So remember that for Zuri Health, we're not charging you extra for coming to pick up your samples, no. We're not saying you must travel with this particular airline, no. We're saying if you're in Nairobi and you're leaving and you're traveling across multiple countries in Africa, specifically in a couple of routes, Ghana, Nigeria, South Africa, Lusaka, Zambia, that we're able to provide COVID testing in those locations at your convenience. So you could think of how to go relax in your hotel in Lagos, and somebody will come 24 hours before departure, take your sample, and email you your results. Similar things we're going to be doing in Johannesburg, in Cape Town. Similar things we're going to be doing in Lusaka, in Dar es Salaam, and in Kampala. This is the beauty of the Safiri Zuri. So think about the opportunities in terms of the convenience, being able to get the COVID test at cheaper than the market rate by going to the labs. Think of the convenience of a 30-day free telemed consultation with a doctor that you would need, or even if you don't need the assurance of having the ability to get 30 days medical consultations with a doctor.
All right, guys, thank you for sticking with us until we got here. So we have some questions from the live that we would like to have addressed now, that rather you would like to have addressed. And the first one is, can I video call a doctor on the app, or do I need to have a Zoom open? Okay, no, that was not the question.
We'll be able to video call a doctor right on the app, so you don't need to have a Zoom open.
Also, so there's a video call option available on the app. Oh, okay, that's great. Okay, next question. How can others in the healthcare industry get involved with Zuri Health? I'll ask Daisy this.
Very, very much open to partnerships. It's very easy to partner with Zuri Health. If you're a healthcare service provider and you're licensed to operate, you are certified by your government or where you reside to actually offer these services, you can just talk to us, email us, or simply just download if you're a doctor, you can simply download the app, upload all your requirements or information, then we'll verify your information from the back end, and your profile will be okay. Open your schedules and you're ready to start providing your services to our pool of users.
Wow, that's nice and easy. Next question. How long does it take to get a COVID test? Can I ask Dr. Moka to answer this one?
To get a COVID test. The COVID test processing is now quite effective. It usually takes anywhere between 45 minutes to 2 hours for an actual run time. So that's the actual test time. And then you'd give another 2 hours for processing of the data because you have to interpret the curves before you release the results. So I would say production time, 2 to 4 hours, and then typically sample collection time, 2 hours. So I would say 6 hours you could expect your results in the our facility and a few other facilities. Other facilities that have some of the older platforms, they require about 8 hours of sample handling before they release the results. So technology has shifted quite rapidly with the pandemic. At first, the PCR test was a 48-hour process. Right now, we're doing it in 6 hours.
I even need to ask again, because I'm traveling, I need to know these things. So I'm on the Zuri app. I go in and I want to get a COVID test. So I schedule for the COVID test. They come to my house within how long? 2 to 4 hours. So 2 to 4 hours, they collect the sample. It's back with, let's say, Dr. Moka within 2 hours. So from the time I ask for it to the time it gets to him.
12 hours.
So 12 hours.
SLA is 12 hours.
So if I'm leaving tomorrow, I can ask for the test in the morning and have it by evening, so I'm fine to travel.
Yeah, by midday.
Wow.
Yeah.
Okay, all right. All right, next question. What is the requirement to join Zuri, client and doctor? I'll ask Ike to take this one.
I think I think Daisy had actually addressed the part for a, client, who are our clients? Our clients are pharmacies. We onboard pharmacies, labs and diagnostic centers like Laleshore Pharmacy. We also onboard hospitals and clinics, boutique clinics. We have strategic partners like Checkups Med, handling labs and diagnostic tests. So basically, you need to be, in good standing with the government. You need to be regulated, have all the documentations required and necessary, because those need to be verified. We have a verification process of every 3 months. We re-verify. For doctors, you need to download the app, register the KYC information, share them. And we have to run back to each country has multiple requirements. So for example, in Kenya, the Medical Dental Council Board will have to look at your, you have to see if this doctor is in good standing. And if they say this doctor is in good standing, then we activate your profile. Then you're able to get. Then for the users, all you need to do is get onto the app, register. And if you do not have a smartphone, send the text message to the short code, which is peculiar to your country. Then if you don't want to text, you can also go on Facebook, on Instagram, or on WhatsApp and engage us with our AI interface, and you're able to get seamless services.
Yeah.
Oh, wow, that's pretty straightforward.
I'd like to add to what Arthur just described on the, in terms of some of the lessons we've learned as providers. Yes, you have to be certified and be in good standing. But I think it also requires a doctor of a certain, to bring a certain personality to a phone call. You have to be reassuring to the person because it's distant. You have to be able to kind of understand their social setting within the shortest time possible. Those are things which, when the person is walking into the room, you are connecting lots of dots, right? And now you have to do that virtually, right? To kind of relate to what the person might be dealing with. Is it a mental health issue? Is it an intoxication issue? Is it, a chronic issue? What is their willingness to kind of come on the journey? And you have a timeline to do it, to kind of complete. So it's putting a little bit more demand on the provider in terms of their willingness to kind of observe very keenly remotely, but also to document. Because obviously the app would force you to do more documentation that you might otherwise not do, right? So the resistance you might get from the provider side is, well, it's taking me longer to document the case, because when you're doing it on an exercise book, you just write, you know, and you're done, and you say, please keep moving, you know. So, so this, in a way, also say it should improve the quality of care or the demand, because you have to interrogate and you have to document more. I'll be willing to do that, at least.
And have a really good virtual bedside manner.
Yeah, exactly. Virtual bedside manners is exactly the case. Yeah.
All right, let's take the next question. Okay, I still have an old Android. Can I still get the app? I think I actually talked about this in terms of text messaging. I guess what I had to follow up was, so how do I, as a person with an old Android, how do I get that information? How do I get the number for the texting? Where do I find that?
So for a person with an old Android is still able to download the app. So even if you don't have space on your phone, you're able to use the WhatsApp, your normal WhatsApp. You're able to get the AI interface on WhatsApp, and you're able to engage and do labs and diagnostic booking, pharmacy booking, and chatting with the doctor on the WhatsApp interface. Then we're going to be we're still marketing, engaging with multiple marketing. And I like the question about ask, how do I get the information? One of the strategic things of the Zuri Health advantage is our partnership with telco companies.
Yeah.
The telco companies will tell their subscribers to engage with doctors to get first level medical consultation. Text this to this number.
Wow.
So remember that we, and that was in terms of what we said, our Zuri Health advantage, the ability of customer acquisition with these telco partners. In 6 months, we have over 200,000 subscribers on SMS in Kenya, and it shows you how huge the potential and opportunity of partnering with multiple telcos across the continent.
Wow, this is so exciting. Okay, so how much does it cost to send and receive SMS per day? Daisy, do you want to take this?
Yeah, sure. So it costs, in Kenyan shillings, that's 5 Kenyan shillings to actually consult and chat with a doctor. And also in other markets, in Nigeria, it's about 20 kwacha.
20 naira.
20 naira. Yeah, in dollars, it's like 0.05 USD. And you're already, as soon as you send a text, as long as you're a subscriber, the doctor responds to you in 3 minutes maximum.
And in addition to that, one of our things that we do is remember is that the SMS component is supposed to be very cheap, which is just a little slightly above the normal text message rates. So each market, the average revenue per user determines in terms of what will fix its cost. So in Nigeria, for example, is about 20 naira. In Zambia, it could be 9 or 10 ngwe, depending on which market it is. So every market, the average revenue per user on the market determines how we fix the SMS cost. But it's supposed to be very, 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 very affordable to allow for deeper inclusivity, and for the underserved market.
Wow. Okay. Can we have? Do we have another question? We had this already. Is there another question? We started with this question.
So, and also it's important to point out that the questions as we're evolving, the questions will keep coming on the YouTube channel, on our Facebook page, on all our social media handles. The team will be responding individually to these questions, and we're putting up as customer education, because one of the things that's very important that we're investing in is customer education. Yeah. People, telehealth is still new, or the evolution of telehealth, the real thing, because I always argue that telehealth has been in existence for a long time. People always call their doctor friends or pharmacy friend, but as a means of proper healthcare and structured environment, it's becoming new. So a lot of consumer education is important to be able to get people comfortable with it, to be able to enlighten people that we're not conditioned anymore to go to brick and mortar hospital. Yes, we should go, but a lot of the things that we need to do, we're able to do it virtually. And that will be very important. So a lot of consumer education, also being able to package a product promise in a way and manner and a communication tool that people who are in this underserved community need to be able to understand. So part of our Zuri Health advantage is that the doctors in each country the doctors who are going to be on the app are doctors who are qualified to practice in those countries, which means Dr. Olan can respond in Kiswahili to a non-English speaker in Masrabit. And in Dakar, Senegal, Dr. Yusuf will be able to respond to somebody in Dakar in French. So the language option is, part of the model 2.0 is that the app is multilingual, so you can pick a language that you want. And the SMS component is also very important.
In fact, speaking of the SMS component, I think this is what this question is about. So am I able to consult a doctor if I'm not connected to the internet?
Fantastic. Those are the people who built Zuri Health for. They underserved people who don't have access to internet, the ability to be able to get first-level medical consultation, triaging by text message.
Wow, okay. I think that those are all the questions that we have. Yes? Yes?
Can I get a medical consultation through WhatsApp? Yes.
WhatsApp.
Our AI, we've built an artificial intelligence, functionality of the app that allows you to engage not just on WhatsApp. So if you're on Facebook, you can go to the Zuri Health page and interact with our AI interface. If you're on Instagram, similar interactions exist.
Okay, so I think one of the things that we'll definitely need to do as we come to the end of it is we'll put up on the screen the social media tag so that people can find us on Twitter and Instagram and Facebook. In the meantime, we just want to thank you so much for tuning in today. This is such an exciting thing that's coming up. We're talking about a hospital in the cloud, which is convenient and affordable and basically accessible to anybody in the countries that it's there for, online, on your phone, by WhatsApp, by text message. And I think this is something that's so exciting. So we actually just want to thank our panel again for being with us. Thank you for coming. I want to thank Ike and Daisy for making this happen. Yeah. And we want to thank you for joining us. These people have asked me to be moderator.
You have to sing.
Now they want me.
End it with a song. One song. One song. One
okay,
song.
Then let me say bye first so that you'll end on me.
Yes.
Okay, fine, everybody. One song. One song. Do you have a track or something? I'm picking up the pieces of me. I'm wondering just how hard it would be, 'cause the last 5 years had me drowned in tears of love. I hide behind a book and a dream. The pain had pushed me up to the brink of my deepest fears, and me drowned in tears of love. Love on me, love on me. Tried to hang my boots and give up. These cycles had my head in a trap. I'm just trying to live, but I'm drowning in tears of love. Get the Zuri app, download it. The song is not there, but download the app, and we'll see you next time. We're doing something exciting, yes? All right, everybody.
Thank you very much. Thank you, everybody.
Thank you.